a man ejaculates lesser than 5 minutes after the initial penetration.
Longer the duration, better the sex. Is it really true?
So when you say longer is more pleasurable, that's probably often because women take a longer time to orgasm. The only position what we say is take the legs and put it on the chest and hold it for at least maybe 1 to 2 minutes.
Hello everybody. Welcome to this episode of Hello Doctor. Today we are going to meet and talk to Dr. Surakshit Bhatina, MD. Hello sir.
Hi.
First of all, I'd like to ask this question. You're into gynac and IVF. You'll be seeing a lot of women coming and talking.
Yes.
How open are they when they talk about sex? Because sex is still a taboo topic in the current society. So how do you look at women talking about sex? Are they talking about sex?
Yes, I think now that doctors are able to give more information online, people are also more familiar with you talking about sex. So when they see me online, they see me on Instagram, they see me on YouTube, they already have a familiarity of what I am talking to them about. So they already have the questions in mind. So when they come into my office, they pretty much have a complete idea of what they want to ask. So it's not they're not going to come in here and trying to discover what they have. They already know what problem they have, so they come up to me with the treatment plan. They also tell me, doctor, we can go in this way and we can go in that way. So I think it's very open nowadays. People do want to make sure where the problem is. They want to get all these sexual issues resolved. And I think it's a great time.
You said me they come with the solutions.
Yeah.
So do they Google a lot about these?
These women have actually tried everything under the sun. Because whenever you have a sexual issue, right, women, I don't know, for some reason take it to heart. They take it it's really bothers them a lot more than men who have sexual issues. Yes, I do know men who also come to us with other sexual issues as well, but women generally are a bit more affected by this condition, and of course they do know everything about the situation, so by the time they come to me, they already have their treatment plan.
Actually, talking about this masturbation and stuff, women and vaginal masturbation is not talked about much in general. We talk about men masturbating, excessive masturbation a lot, but women, is it safe to masturbate for a woman, or how can a woman experience that orgasm without having sex?
Women have, just like how men have, women have 3 phases. You have the arousal, then you have the plateau, and then you have the orgasm, and then you have the resolution. So these 4 stages are the same for men and women. Only thing is the intervals are not pretty much the same. So men have a fixed interval, whereas for women it is not always fixed. There are women who are anorgasmic, which means they don't have an orgasm at all. So some people have arousal issues. They don't get arousals. So we need to understand where the issue is and deal with them accordingly. So when you're asking me, is it normal to have, if a woman masturbates, of course it is normal, just like how it's normal for a man to masturbate. It's only the situation is different for men and women, because at the end of the day, men have an ejaculation, and then once after an ejaculation is done, there are possibilities that they will really not have an intention or to do something else after that. They want to go into a complete state of resolution. So to get out of that, we always say you make sure it doesn't really spoil or affect your quality of life. The moment it starts affecting your quality of life, that's when you have to take a back seat and understand this is a problem. You need to either reduce or completely stop masturbating.
Okay, so how do we know that it's going to affect the quality of life, maybe for man or a woman, masturbation and quality of life? How is that connected?
So when you look at quality of life, I'm talking about both at your professional and also at your personal level. For example, if it is affecting your family life, you'll rather spend time watching the screen rather than with your loved ones, maybe with your girlfriend or with your wife. You spend lesser time because you're more of the time on the phone, and things in reality will not really it will not really impress you as much as what you see online.
You mean porn?
Yeah, of course. When you're looking at masturbation, most men are visual, which means they do look at porn before they go ahead and they masturbate. So when that is the situation, right, when your brain is stimulated with things which are probably unreal or not real. So that's when you get used to that. So the normal, whatever is normal, might look like it's not really interesting to you. So that kind of desensitization might happen for people. So during that time, definitely that is affecting your quality of life with your with yourself and your loved ones. And the second one is, when you're looking at office work, you become slogging at work. You're not really able to work like how you could have worked before, or your grades are not very good. Again, you can see, it is not really improving your quality of work as well. So when these things start affecting you, I would say that is the time you need to retrospect and take a decision whether this is the way you want to go, you want to change your direction.
So, talking about sex and everything, generally there's this idea that longer the duration, better the sex. Is it really true?
The problem is we don't really have, so we cannot define what is long. We do know there is something called as premature ejaculation, which is an issue where a man ejaculates lesser than 5 minutes after the initial penetration. So anything longer than that is fine. Anything lesser than that, we would say go and seek treatment, because there are so many things which are out there which men can take to improve their chances of having a longer ejaculation. That is, when you say the world standard is only 5 minutes. So when you say longer is more pleasurable, that's probably often because women take a longer time to orgasm. So always I say, try to engage in foreplay, because that is the best way of how we can get started. So that, and again, it never happens that the men and women ejaculate, or orgasm at the same time. It hardly happens. So at that point of time, we always say you can either do it in turns, or most likely, get the woman to ejaculate first, to orgasm first, and then the man ejaculates later.
Okay, so there's a book by Paulo Coelho written 11 minutes.
Okay.
So 11 minutes, basically,
Yeah.
he says 11 minutes is the duration anybody can have sex. Is that true?
It depends from person to person. There are even people who take a longer time. In fact, it's a condition where, the man takes a longer time to orgasm, right? So, and then during that whole process, because it takes such a long time, he doesn't have enough energy to even perform after that. So then, they just end up not having an orgasm. So that also is a problem. So, I would say the ideal duration is like, I would say something which is more important to them as a couple, and they decide among themselves what is their ideal time, because of course even going longer, some of the women also might not be interested in that. So you'll have to see, it's a give and take, I would say.
So I heard something about this G-shot that is trending right now.
Yeah.
So what actually is G-shot?
Before we start talking about G-shot, we need to know what is PRP. PRP is nothing but platelet-rich plasma. You have people injecting PRP in the scalp,
Hair.
for the skin, and everywhere else. So basically the idea is to make sure we are regenerating more number of, we are injecting platelet-rich plasma inside these cells, so we have regeneration of possibly new collagen tissues, so probably new vascularization, new nerve tissue formation. All of these factors happen, or even in fact new, like what happens when you cut yourself. So you obviously have new tissue which is forming, right? There's the same idea between that. You have new tissue forming in this particular area, so that ideally more nerve supply, and ideally more blood circulation. So what happens when you have more blood circulation in your clitoral area?
Okay.
So that was the concept, which was first started by this guy called as Charles Runes. So what he did is he went and injected this for his girlfriend, and then he realized that she was having better orgasms, she was having more arousals, and things like that. Although there are no evidence, but it does work for few people. We do have a lot of women who are coming in and getting these G shots. I would say maybe around 50 to 60% of them do have more arousals, especially women who are having libido. This I would say is not for younger women. I would say this for someone who's 45 beyond, because they're the women who suffer from libido. They're not able to have proper sexual intercourse, and because they don't have the intention, or they don't have the mood to go ahead for it. So at this point of time, we go ahead and inject the G shot, and definitely that improves on their arousal and probably in the time of orgasm. That was another thing we spoke about, right?
Yeah.
So we are effectively trying to reduce the time it takes for them to orgasm as well.
I had this doubt. So
Yeah.
we know that PCOD is something that's there in most of the women in recent times,
Yeah.
and PCOD or PCOS for that
Yeah,
matter.
yeah.
And girls with PCOD, PCOS, they have irregular periods.
Yeah.
Do you think having sex or being intimate with the partner will help them balance their hormones?
It's very unlikely, but what I have seen is what happens is after marriage, many people they they start putting on weight. So when they start putting on weight, generally their menstrual cycles also become a bit more irregular. I would say PCOD has very less to do with this rather than lifestyle. So if anyone has a healthy diet and they exercise regularly, that is more of a reason which will regulate their hormones and make them more prone to having a normal regular menstrual cycle rather than marriage, because I don't see how it can actually change anything.
So also talk about PCOD
Yeah.
and getting pregnant. How
Yes.
difficult it is for women with PCOD to get pregnant?
I would say out of maybe 100 women who have PCOD, maybe around 10% of them only they will have an issue in trying to conceive. It's
Okay.
not too much. It's very less. The women who mainly have a problem is the ones who have resistant PCOD, which means even though whatever medications we give them, they are not able to release that one egg every cycle. So for those people, they'll have to undergo treatment. Maybe something like a laparoscopic ovarian drilling, or maybe something like an IVF or ICSI, for them to conceive.
Also, there's this general idea that certain sex positions
Yeah.
will help women conceive faster, or
Yeah.
when they are trying,
Yeah.
like this what making baby
Yeah.
making sex.
Yes. Yes.
Yeah,
Yeah.
is there any positions like that?
Although they say that whatever you after you engage in the sexual activity, the only position what we say is take the legs and put it on the chest and hold it for at least maybe 1 to 2 minutes. That gives enough time for the sperm to go and penetrate through the cervix and into the uterus. So I don't think there is any particular position per se, but whatever gives good penetration, whatever gives you enough penetration into the vagina should be fine, and that depends from person to person and couple to couple.
Us.
Yeah, yeah, yeah.
Also, sir, talking about sex, there are people who experience pain during sex.
Yeah,
I mean,
yeah.
how do we handle that?
Yeah, there's a very peculiar condition called as vaginismus, where we give them 5 grades. Grade 1, where they're able to have some kind of penetration, but not completely. Then the second one, where even if you have something touched near the vaginal vulval area, they're not able to have any penetration. They have a lot of pain. Third one is even the thought about having a penetration, they are going to have excess amount of pain. So like that we have 5 grades, and the reason behind this is multifactorial. It's because of anatomy, that is the whole muscles contract at the thought or even at the option of having something going into the vagina, which means they would have never had a tampon placed till now, or they would have never had a sexual intercourse as well. The other one is psychological, because we all in India, we are a cultural community, isn't it? So the culture plays a very big role in our how we are and
Our
our
lifestyle.
lifestyle, everything, our mindset, everything. So that also causes a lot of changes in the women. And of course, the how Bollywood shows like sex, like women always running away from sex, and guys always chasing women. So all of these things psychologically affect the women, and they're not able to have a sexual intercourse. So the treatment for this sometimes they get done within 1 month. It's a very low grade of vaginismus. Within 1 month, they're able to have sexual intercourse. For some people, it takes more than 6 months. For some people, even more than 1 year, because psychologically they're so affected by this. So ideally, it's just trying to make sure their bodies and they're mentally and physically able to have a sexual intercourse. And after I made one video on YouTube on this, a lot of people started. I've understood how big the problem was only then, because the number of people who are coming and seeking treatment for the same has been many. And finally, if nothing works for them, we have this botox. How they inject botox on the face is just like a muscle relaxant. So we put the same botox in the vulval area so they don't really have much of a sensation when there is some entry inside. So, and once they are used to it, maybe to 4 to 5 times, they understand, yes, we are able to have sexual intercourse. Automatically, their mind also gets okay with the situation, and when the Botox wears off after 6 months, at that point, they are absolutely fine.
Could this be because of physical insecurities?
Yeah, yeah, absolutely. Because most of these women I've understood have absolutely no idea how their vulva looks. They have never seen it. They don't want to know how it looks. So yes, of course, insecurities also might be a part of it.
So also, sir, talking about this postpartum weight gain after pregnancy, after the childbirth, usually the mother tends to put on a lot of weight. So how do you, talk to them, or how do you treat them to, get back to their shape?
The first thing what we do is for patients who are pregnant itself, we start having a monitoring of their weight. We always say, no, you have to put 10 kgs during pregnancy. It's actually not true. Baby itself is only around 2.5 kg, isn't it? Where's the other 7 kgs, right? So what we try to say is, don't put on too much weight during your pregnancy. It becomes much easier for you to lose it afterwards. So when this happens, right, then automatically their mind is tuned to not put on too much weight during this time. If by chance they do put on too much weight, there are of course so many things we can do. Like for example, the weight reduction programs and everything else. And now all failed. Maybe we have tried for 6 months and it's still not working for her. That new belly fat is really bothering her. At which point there are non-surgical techniques what we do, where we basically put this magnetic energy over the muscles. So what it does is it automatically crunches the muscles. Okay. So if you're not able to go to the gym, you just put that over your abdomen and it starts crunching your muscles. So it's like doing 12,000 crunches in 20 minutes. So that initial energy what we put up for the patient, by next 3 to 4 weeks, usually the abdomen becomes flatter than what it was before. That is one way of treating it. Then of course women also have sometimes issues of, whenever they cough or sneeze after a normal delivery, they might have leaking or dribbling of urine.
Yes.
The same energy what we use for the abdomen, we can also use it for the pelvis. So we are strengthening the pelvic floor. Like, because I ask women to go and do a Kegels exercises, it's very difficult for them. Like they'll do 1 or 2 Kegels maximum, and then maybe for 5 minutes they can do. After that, they're like, doctor, I can't do it for too long. So at that point of time, we make them sit on this Kegels chair. It's like doing around 12,000 Kegels within 20 minutes. So we do this maybe around 4 to 5 sessions, and then mostly these women don't really require, wearing a pad anymore if in case they're having dribbling of urine or not. And of course, you have also other, aesthetic issues, if they're having breast sagginess or if they're having stretch marks. All of them are being addressed right now. So, of course, because now I think in our world, we're giving a lot of importance to beauty. And people want to look good, people want to feel good. I think that's the way of how we want to see it, and I think it's a good way.
So also talking about the sex therapy, basically recent times we see a lot of divorce happening, and you look at the reason, no, sexually we are not compatible. So these are the, it's happening right now, and I don't know how far they are open enough or matured enough to go and talk to a therapist, especially about sex. Do you think this should happen?
It's already happening quite frequently now. In fact, most of the women who come for treatment for me, we do send them to psychological counseling, and especially this new field called a psychosexual counseling. So this is very specific only for people who are suffering from these issues, and it has done wonders for these couples. Many people were able to bounce back into their relationships. They're able to find so many new things about themselves. The reason is because there are things you cannot really talk to your partner about. You would be more comfortable talking to someone else about it, isn't it? So when you have a third party involved and you know that information is not going to go anywhere, I think definitely that is one way people have started opening up. And that's actually very good for us.
Also, sir, on a minor note, this has been, we've been talking about this use of tampons and menstrual cups. But still, there are girls who are contemplating on how to use a tampon, or should I? They think pads are a more safer option because it doesn't need any extra effort to put it in. So, what do you have to say to those girls?
So I think there are costs, there are benefits of both, there are risks of both as well. For example, the benefits of pads is, of course, they're very freely available. You can get them anytime over the counter. Of course, the negative effects are they have recently shown that they're having chemicals in those pads, plus also the adhesives. They will touch on your skin, and then it might cause a lot of scarring and rashing over there. The other issue is where we have in cups in that manner. Of course, they are not very readily available, and of course there's a learning curve to it.
Yeah.
You just cannot directly insert it. You need to know exactly how to insert it. You need to press the cup, fold it into half, and then put it in. So of course you need to see it first, or you need to get someone else to do it for you first. It is a little bit cumbersome, but of course again the good thing about it is it's again reusable. I've seen people who said that you can use the same cup for 10 years as well. So that again is a positive effect of it, and of course environmental friendly. You're not going to throw out these cups anytime soon, so they will be, you can use them for quite a lot of time. And I would say, if you can just get over the fact that you have something stuck or you have something inside the vagina, I think it's a wonderful alternative.
Great talking to you, sir.
Yes,
Thank you so much for your time.
Thank you so much.